Well, welcome everyone to yet another Your Health Partner brought to you by Lehigh Valley Hospital, Hazleton. You know, there's so many things that you don't maybe know about what's happening at the hospital. Today, we're going to try to give you an in-depth understanding of inpatient care. A lot of things go on. In fact, in this beautiful place, if you see the books here, they told me I have to read every one of these books, but I'm not. Okay, we're at the medical library here, and we're going to learn a lot about the inpatient service. You know, one of the things that if you are involved in the hospital, you'll get a survey form, and we're going to talk about those survey forms. They're very, very important. But joining me now, we have Jolene Scatton, and we have Melissa Colanardo, right? So you tell our audience what you do.
I am the director of our Med-Surg telemetry unit and our Med-Surg orthopedic unit, and I also oversee the float pool nursing team here at the hospital.
Okay, now Med-Surg means?
Med-Surg is a generalized surgical floor, and then we specialize in telemetry, which is our cardiac patients on the 5th floor, and 4th floor we also have orthopedic surgical patients.
Tell me about yourself, because I know you have a passion for what you do. I sense it.
I do. I'm going on my 18th year here, if you can believe that.
Oh, so you're a rookie.
I'm a rookie, right. I started as an LPN back on the 5th floor, actually, back then. As an LPN, I took classes the whole time I was working towards my RN. I finished my RN, and then I still worked on 5th floor for a while, and I grew an interest in the emergency department. So I also worked in our emergency department here for 4 or 5 years. And that's kind of when I obtained an interest in leadership roles. So I actually was our Hazleton's first stroke and chest pain coordinator here. And then after that, a management position came. I was actually in Melissa's role. After the stroke and chest pain coordinator role, I became a manager for the 5th floor, and here I am.
Give me an idea of exactly what your day looks like.
Everyday operations, from staffing to ensuring that our nurses have the tools that they need to take care of our patients. Education, we do education with our staff, and we'll even do with patients. We also round on our patients, which we could talk about a little bit too, nurse leader rounds. Even as leaders, we introduce ourselves to our patients that come to our units. It's a busy day.
Well, you're meeting people, they're sick, okay, and there's all kind of emotions going on, okay, and I know, you have to adjust to those emotions, okay? Yeah. How do you do that?
I don't know. I guess that's why they say it's not for everybody, because it is. It's, you have one room that you have a critically ill patient, and then the next room you have somebody that's, not as sick maybe, and you kind of do have to swing your emotions like that. It is challenging, and especially in the emergency room side of things, it certainly gets that way.
So there's the 4th and 5th floor you're working
Yep.
on. What are the difference between the both floors?
So 4th floor is, again, Med-Surg, and we specialize and put our orthopedic patients on that unit. So if you're here for an orthopedic surgery, that's probably where you're going to land, on the 4th floor. Our 5th floor, if you have any issues with cardiac, heart failure, chest pain, you will predominantly go to our 5th floor, because that's where we specialize in that.
Now, in putting together, you have to coordinate with the doctors, right?
Yep.
Okay. So how does that coordination work between, when every patient's different?
Yeah, it just depends on case by case. So the patients will be admitted through our emergency department, the majority of them. A lot of the times the doctors already have orders in on our patients so that they come up to our units prepared for, their stay. And then if nursing, our nurses need to reach out to them. We use a Tiger Text Connect group, and the hospitalists in our group of doctors are usually rounding constantly.
What's Tiger Text?
Tiger Text is like text messaging, but it's a secured messaging system, so the nurses and doctors can communicate with each other.
How much information can you give that patient? Because, sometimes they'll ask you questions. I'm sure I'd be asking 1,000 questions. How much information are you allowed to discuss?
So nurses, we don't usually like to give test results. We don't usually discuss that. We usually like to have the providers discuss that, but nursing are very hands-on, and they do communicate a lot of information to our patients about their stay. One of the initiatives is patient education on why they're here. You know, they're admitting diagnosis and any new medications that they may be on while they're here and may go home on.
How important are those survey forms?
Extremely important to us. We look at those surveys. First and foremost, it gives us feedback on how that patient's hospital stay was. And it goes through, you know, it goes over their room, how their room condition was, their diet, their food that they were given, nursing responsiveness, doctor communication, and we look at that, take it very seriously. But most importantly, again, we get the patient's perception on how their stay was, which is first and foremost. And then also we look at that as the leaders on the inpatient side and the emergency department to see, like, if we need to maybe tweak one of our processes to make it better.
Melissa, so you are the patient care manager, right?
Correct.
Okay, so tell me, what do you do?
We oversee the day-to-day operations on the unit. So some of my role includes we staff the units, make sure we have enough staff for safe staffing to care for our patients, scheduling, payroll, all those type of things. But most importantly, we support our nursing staff and we make sure they have what they need to do their job effectively. We do patient rounding. We like to see our discharges. We like to see our admissions, welcome them to our units. We also like to monitor our quality, our patient quality, to make sure we're caring for our patients to our standard.
So tell me, Melissa, about rounding.
Patient rounding is one of our initiatives. We want to ensure, I like to think of it as we're taking care of our patients' needs before they can have them. Specifically ensuring that we have a staff member in each room at least once an hour. Our nurses and our tech partners will work together to take them to the bathroom, check for pain, make sure they have what they need nearby, change their position. So including that as one of our initiatives will help anticipate the needs of our patients before they can
Actually need something.
Right.
So everyone is treated individually, but there's a team effort that works with that inpatient. There's a lot of things happen when you're in a hospital that patients don't know, nor the families know, or
we also work very closely with leaders of the other disciplines: housekeeping, dietary, radiology, therapy, case management.
Yes.
That's a good question.
We all work together to take care of our patients and give that high quality care.
So you need a history then on each individual patient.
Right.
So you know, and so now you're working with another nurse, right?
So we have, Jolene's the director, I'm the manager, and then we have specifically, depending on our census, specific nurses who each have their own patients. And then we also have tech partners who assist us with the patient care, our vital sign, sugar checks, things like that, feeding our patients. I was born and raised, I started very young, here 17 years. This facility, we all work together as a team and we want to treat our patients like family.
For sure.
We take our jobs very seriously. We have a very strong working team. We have several initiatives ongoing to care for our patients. We focus on that high quality patient care.
Keep the good work up,
That's
too,
right.
folks.
Thank you for having us.
Well, yes, your health partner, my friends, is brought to you by Lehigh Valley Hospital, Hazleton. We'll take a break. We'll be back with more after this. Well, welcome back to your health partner, my friends, brought to you by Lehigh Valley Hospital, Hazleton, and they are your health partner. You know, there's so many things that you don't know what happens in medicine, and today we're experiencing what happens with the inpatient care. So many things happen when you're here at the hospital. If you just joined us, you know, we show this show many times. We're on our website, ssptv.com, and YouTube channel. A lot of great information that happens, and it's good information. Joining me now is Neil Coker, who is the administrator here, clinical services, and Amanda Harhut, right?
Yep.
Okay, and you're the manager of the ER patient care services. Okay.
Yep.
Neil, let me start with you. Tell me a little bit about yourself.
I've been in the network for 25 years. I've been here at the Hazleton site. I'm a Luzerne County born and bred. I'm from Mountaintop, so when the director of the ER job opened up, I applied for it. So I've been here at the site for 3 years, and I recently got promoted to administrator of clinical services back in June.
So tell me about clinical services for the layperson out there. Like, what do you do? What's
So
your
clinical
job?
services are, for the layperson, basically the bedside care. So the bedside nurse, the bedside tech partner, anybody that gives bedside nursing care is what pretty much clinical services falls under.
So we were talking about team effort, okay? So how do you structure your part of the division?
So our team is based on, as administrator, the ER directors, the inpatient directors, the obstetric director, all report to me, and then the patient care managers report to the director. So it's kind of a tiered, structured approach, and then I report directly to the CNO, the assistant, the vice president of nursing here at Jody Shigo.
So what are they telling you on this report?
So when they report off, we go over the daily census, we go over any issues that may have happened throughout the day, at night, we go over any problems that we are anticipating based on our staffing or our census. We try to do any kind of service recovery on a patient that might not have had the best experience. You know, any problems, whether it's from dietary to anything clinical, we just address it real time. So it's it's a daily operations type of job.
Yeah, and that's what, many years ago when I was in partnership with Jack Palance, we were doing a show, and after the show, I asked him, I said, Jack, how'd you like the show? He said, well, Sam, the show was good. He said, but he said, what you need to do now is look at that show, and how would you make that show 10% better?
Right.
How do you make your division 10% better when you're looking at reports and you're looking at structure, et cetera?
So we evaluate what's called our daily metrics. It's things like, how many patients did we see in the ER? Did anybody leave without being seen? How long did they stay in the ER? Just for example, inpatient, how long before they were transferred off the floor? We look at that daily, and I can tell you, Sam, every day we always think of ways that we can make it better for the patient. We want the patient to come in and have a very positive experience from the time they hit our door to the time they leave. So whatever makes the patient happy, whatever we can do to make the patient happy through their entire stay.
A lot of people don't understand the structure of when a person comes to ER, okay? Some people feel that, we should be in a room immediately, or we should be doing this, or we'd be shooting that. Make me feel at ease as to knowing that you know what's happening when that person goes into the ER, and there's procedures that are being done. Would that be in your area, or his area?
Either one.
Yeah. Well, tell me how.
So we have a charge nurse on at all times that does not have an assignment. So their job is to strictly monitor flow throughout the department. They can see the waiting room. They can see what we have waiting, what kind of patients are there, who needs to come back. We go by an acuity system.
What's that?
So it's how we triage our patients. It's a severity. So severity 1 and 2 are higher than 4s and 5s. And then those are the types of patients that require emergent care immediately. So they're life or death situations. So those obviously need rooms quicker than some others. But we just have the charge nurses keep the flow of the department going constantly. That is like their job.
So you're monitoring it all the times, and so
Correct.
the point is, even though I may be there getting ready, another person comes in who's having the pains in the chest or whatever. So that's how do you do your evaluation? I mean, who makes that evaluation? You as the manager, or the doctor? Who makes it?
So there's a triage nurse out that's with the patients, asking them all of the questions that we need to know the information to. And then they're communicating with the charge nurses and the doctors, and then the management team if needed.
Tell me what triage means.
Triage is the first thing you're going to get when you come to the ER. You're going to be asked a lot of questions that you're probably going to be asked over and over again throughout your stay. You're going to get some vital signs done so we can see where you're at. You're going to get, if you have a wound or a burn or something, somebody is going to lay eyes on it and see what it looks like and see if there's anything that needs to be done immediately. And then the last part of the triage is communicating that with the charge nurse to tell them what's needed.
Neil, an emergency room is called emergency room. Anything can happen, okay? And when do you decide when a person's coming in, oh, I better call Dr. Lassand? All right. When do you know that you have to call a specific person that's a doctor or medical person?
Nurses are trained to recognize sick versus maybe, we call it sick versus maybe not sick, right? So if somebody comes in with maybe a scratch on their hand, not saying they don't get treated, obviously they do, but if somebody's coming in that's sweaty, doesn't look good, short of breath, that's obviously a higher priority. So nurses are trained just by their nature and by just being in the experience of the world of nursing to know sick versus not sick. So we obviously take the higher acuity, higher level patients first, okay? So like Amanda said, the ESI 1s, ESI 2s, they're going to get our emergent treatment because we are an emergency room. We are going to treat the emergencies per se. The other, you know, people come in with a cough or a cold or stuff, we are going to still treat you. And our job here is to make sure no matter what you come in with, you have a positive experience. We get you through as quick as we can. We give you safe care, and we treat you with respect and compassion. That is our goal here.
Why did you go into nursing?
I at first wanted to be a doctor, but then I realized that nurses are the ones that do it all. So that's why I chose to do nursing instead of pursuing medical.
And how many years?
I've been a nurse since 2016.
And what have you learned throughout the years, Neil, in nursing? Because you've been around for a while.
Yeah. So, it's a changing profession, and you have to keep on top with your education. And B, a lot of times what's old is new again. Some of the things we did back in the 80s come back 20 years later and re-up their heads. So it's a very interesting profession. It's been very gratifying. I can honestly say it's been very rewarding. If I could go back, I would not change what I've done.
That's great.
Yeah, so, and I think the staff in the ER and the staff in the hospital, and I say this every time I've interviewed somebody or I speak to somebody, what makes Hazleton better than everywhere else is the people. The people here make Hazleton better. We have great people at the bedside. We have great people in leadership. We have great people all throughout this, whether they're in dietary, whether they're in the cleaning services, no matter where they are. Amazing, friendly people. You can walk through other bigger hospitals and people won't even look at you. But when you come to Hazleton, people will say hi to you. People will talk to you. People will converse with you. And that gives people a sense of safety, right? That makes people feel comfortable. And I think that's a huge sell here at Hazleton.
Neil, there's always a need for nurses. So tell me about, what are you looking for?
We really want people that are caring and compassionate, obviously, because you need to be caring and compassionate at the bedside. What we're also looking for is somebody that has a nice way about them, to say it in a simple way. We want somebody that can go into a room, sit down next to a patient, hold their hand, talk to them nicely, get on their level, make them feel comfortable, make them feel relaxed, and be authentic. We don't want somebody to be abrupt. We don't want somebody to be, for want of a better word, nasty. We want people that are nice. And that's really what we look for. We look for the interactions that people have just amongst ourselves, just amongst when we interview them, when we go out to recruit. We look for people. We look to see how they interact. There's always the waiter test. I don't know if you ever heard of the waiter test, but when they would interview people, they would actually see if the person would be nice to the waiter, because then you kind of could tell the character of a person, right? So we look for character, right? We look for somebody that is authentic, that is going to be down to earth, that is not going to be, a problem employee. We want the best here, okay? We want the best here, and we want people to be treated with respect and courtesy. That is a huge part of what we do here. We are big on respect and courtesy. So.
Boy, and that comes from you couldn't say it better, because that's so important. That smile that you give a person who is, and and I know people get busy, but I think that's the teamwork, and the fact that everyone's structured to do what they have to do, and you take things constructively and not critically. I mean, that's important when you have to tell a person that knowing that it's constructive. Am I correct in saying that?
Yep, you are, and our team is very good with that. And exactly what Neil said. I mean, I drive an hour to get to work every day and an hour to go home. I pass 3 different hospitals to come here, and that speaks a lot, because I want to be here with these people. They're a great team. Everybody works together. You need help, you just call one person and they're there for you.
So Amanda, tell me, what would you tell a person who wants to go into the nursing field and the opportunities that are available to them?
I would tell them that it's a great idea. There is tons of opportunity. If you don't want to be in a hospital, there's doctor's offices, there's insurance companies, online agencies. Literally, you can do almost anything in the nursing field, and you will learn so much. And you'll always have a great experience with any kind of patient that you come across, so you'll learn something.
What's the greatest satisfaction you get from your job, Neil?
So I know there's a lot of people out there that you see that where they dread coming to their job. I love my job. I mean, I love my job. I am here early every morning and I stay late every day, and it's not because I love my job, because I like to work the people that I work with, as well as the patients and the family members that we interact with. Again, Everyone's extremely nice. What satisfies me the most when a patient has a positive experience from the time they get here to the time they leave. And I hear about how well the nurses treated me, the providers treated me, the food was amazing. You know, I live for that. We are constantly trying to make things better here. We are constantly trying to make Hazleton the premier hospital. I already feel it is, but we're trying to make it even better. So,
and it is, okay? And that's why those survey forms are so important.
right.
They're critical because that gives a person a good understanding, you know. And I think sometimes people may feel that they may not want to check something, but if it's factual, check it. You know what I mean?
Right.
Mark it down.
And we pride ourselves on a good job. We want to know how well we're doing. So those surveys are very important to come back because, again, we use those surveys to better ourselves. And honestly, Sam, we enjoy the compliments, okay? We like to know we're doing a good job. So if we've done a good job and you feel we deserve a 10, give us a 10. If you feel that we maybe could have done better, you score us appropriately. But, you know, please return the survey because it does mean a lot to us. And we do look at all the surveys.
Anything in closing you'd like to?
Just that our staff like to get those surveys too, because when you can call out a staff member and we can tell them that they were called out on a survey, it makes their day much better. And they know that they're providing the care that we want them to provide and that they should be providing and that they want to provide too.
Well, you have a lot to be proud of. It's a great hospital and great leadership, and you have a lot to be proud of. I hope, my friends, that you've learned something. This is what we try to do with the shows, is try to give you look inside what's happening. So many things happen, but have compassion. These people are there every day for you, from the receptionist to all the people who work in the medical area. No matter where it is, they're trying the best, okay? So you're watching Your Health Partner, and it's brought to you by Lehigh Valley Hospital Hazleton. We'll see you next time.